Welcome in, everyone. Ready to dive deep into female hormone health.
Always ready for a good deep dive.
Today, we've got a really interesting stack of sources to unpack, all about helping you understand your hormones and really take charge of your well-being. From your teens all the way to menopause and beyond, we're learning so much these days about the power of hormones.
It's incredible, right? They really do influence every aspect of our health. It's wild.
Absolutely. So today we're going to be pulling insights from an interview with Dr. Sarah Gottfried on the Huberman Lab podcast.
Oh, I love Huberman Lab.
Oh, it's so good.
Yeah.
A panel discussion on the social CTV, which is all about sexual wellness, some expert advice from a PanCap webinar, and even a video from Monash University that gives us a peek into student perspectives.
Sounds like we'll be covering a lot of ground today.
Yeah, we are. So to kick things off, get this. One of our sources today actually suggests that something as common as constipation might be a red flag for broader health issues.
That's so interesting. It really speaks to how interconnected our bodies are and how we can't just treat symptoms in isolation.
Exactly. And Dr. Gottfried, in the Huberman Lab interview, really emphasizes the importance of understanding your hormone levels early on. Things like testosterone, estrogen, thyroid, cortisol, even as early as your teens and 20s.
Yeah, it's like establishing a baseline so you can track changes over time and make more informed decisions.
Right, exactly. And she even suggests getting a coronary artery calcium score by age 45 or sooner if you have a family history of heart disease.
Oh, that's interesting.
It's a simple CT scan that can actually tell you a lot about your risk for heart problems.
And so you don't have to wait for symptoms to start taking care of your heart. I love that proactive approach.
I know. It's like getting a sneak peek into your future cardiovascular health.
Totally.
And taking steps to, prevent problems before they even arise.
Yeah. And speaking of proactive steps, Dr. Gottfried also brings up something that I thought was super interesting, and I'm surprised more doctors don't recommend it. She says we should be assessing follicle count and AMH, anti-Müllerian hormone, levels much earlier in a woman's life.
Yeah, and those tests, for those who may not know, they basically give you a picture of your ovarian reserve, so basically how many eggs you have left.
Exactly. And Dr. Gottfried believes this information is valuable whether or not you're planning to have children, because it just gives you a better understanding of your reproductive health and potential timeline.
Right. Okay. Let's talk about birth control.
Huge topic.
I know, right?
Yeah.
A topic that affects so many women. Dr. Gottfried acknowledges the benefits of oral contraceptives, like reducing the risk of ovarian cancer.
Right.
But she also points out a potential downside. There's research that suggests that prolonged use may actually lead to elevated sex hormone binding globulin, which could have lingering effects even after you stop taking the pill.
That's something I hadn't really considered before. Yeah. It makes you think about the long-term implications of choices we make about our bodies.
Right. Definitely. It underscores the importance of really having those open and honest conversations with your doctor about the potential risks and benefits of any medication.
For sure.
Okay, speaking of hormonal shifts, we can't forget about menopause.
Of course.
Now, the Women's Health Initiative study, you might have heard of this.
Yeah.
It caused a lot of fear around hormone replacement therapy or HRT.
Right.
But Dr. Gottfried really emphasizes that HRT, when it's prescribed and monitored appropriately, can be a safe and effective option for managing those menopausal symptoms. So it's really about finding that personalized approach that works for you.
It seems like personalized medicine is a theme that's coming up again and again.
Really?
It's not one size fits all. It's about understanding your unique needs and working with your doctor to find the best option.
Exactly. Now, remember that surprising connection we talked about earlier?
Yep.
Constipation and well-being.
I'm so curious about this one.
I know, right? So Dr. Gottfried suggests that chronic constipation, especially in women, might actually be a sign of deeper imbalances in the body. She actually sees it as a potential indicator of stress, hormonal issues, or even past trauma.
I never would have connected those dots.
I know. It makes you stop and think, how we often just dismiss those seemingly minor symptoms.
It's such a good reminder to really tune into your body's signals and advocate for yourself. Don't be afraid to ask questions and seek those personalized solutions.
Yeah, to bring it back to the listener, what's the key takeaway here?
Pay attention to your body's signals, even the subtle ones. What might seem like just a minor inconvenience could actually be your body trying to tell you something important.
That's a great point. And it seems like Dr. Gottfried's insights are all about being proactive, taking a holistic approach to your health, really considering that mind-body connection.
Totally, yeah. And that leads us perfectly into our next topic, sexual wellness. The experts on the social CTV, they emphasize that sexual wellness is a right and a key part of overall well-being, offering both physical and mental health benefits.
I'm so interested to delve into that because I think it's a topic that deserves way more open conversation
For sure.
than it's been given.
Absolutely.
It's so interesting, right? We often think about sexual health as separate from our overall health, but it's really all connected.
It is. And the benefits go way beyond just reproduction. Did you know that studies suggest regular sexual activity can actually strengthen your immune system?
Wait, really? That's amazing. I had no idea. So I guess getting busy can help you fight off those winter colds.
Yeah, it's true. And it's not just about immunity either. Dr. Sheila Wijayasinghe, one of the experts on the social, explains how sexual activity also benefits your cardiovascular health and can even help manage pain.
Oh, interesting. So how does that work?
It all comes down to hormones. During sex, your body releases hormones like oxytocin and prolactin, which have this calming effect and can actually help reduce pain perception.
Wow. So regular intimacy is practically a prescription for a healthier, happier life.
Pretty much, yeah. And speaking of feeling good, Dr. Wijayasinghe encourages everyone to explore what brings them pleasure, whether that's alone or with a partner. She's a big advocate for normalizing conversations about self-pleasure and lubrication as ways to enhance intimacy and connection.
I love that she's breaking down those taboos and encouraging people to prioritize their own pleasure. It shouldn't be a hush-hush topic.
Totally agree. And all the experts really seem to agree that managing stress is super crucial for a healthy sex life.
That makes sense. When you're stressed out, it's hard to relax and be present, right?
Exactly. Dr. Gottfried, she offers a whole menu of stress reduction techniques and really emphasizes the need to find what works best for you. It's about creating that personalized toolkit for dealing with life's ups and downs.
So what are some of those techniques? I'm always looking for new ways to manage stress.
Well, she talks about everything from meditation and yoga to spending time in nature and connecting with loved ones. Really, anything that helps you feel grounded and calm.
Those are all great suggestions. And I think it's important to remember, too, that seeking professional support is always an option, especially if stress feels overwhelming.
Oh, for sure. Absolutely. There's no shame in asking for help. In fact, I think it's a sign of strength and self-awareness. Now, let's switch gears for a minute and talk about the PANCAP webinar, which focused on some really important aspects of sexual health.
Yes, Dr. Kiosha T. Bond, one of the experts in the webinar, really stressed the importance of using inclusive and non-judgmental language when we're talking about sexual health.
Yeah, for sure. She really wants healthcare providers to move away from that fear-based messaging and instead focus on pleasure and empowerment. It's about creating a safe and supportive space for people to explore their sexuality and seek guidance without feeling ashamed or judged.
Absolutely. That's such a crucial point. Everyone deserves to feel comfortable talking about their sexual health. And this leads us perfectly into the student perspectives from that Monash University video. It's so valuable to hear from real people about their experiences.
Oh, for sure. Yeah, the video highlights how important it is to have accessible and supportive sexual health resources for young people.
And the students were so open and honest about their experiences. Some shared that talking about sexual health with their families was easy, but others faced cultural barriers and stigma.
It just goes to show that everyone's journey is unique, and we really need to be sensitive to those differences. The video also emphasized that university health services offer a safe and confidential space for students to get information and support about all aspects of sexual health, no matter what their concerns are.
That's so important, especially for young people who might be navigating these issues for the first time. Okay, so we've covered a lot of ground on sexual wellness. What would you say are the key takeaways for our listeners?
Well, I think the biggest takeaway is that sexual wellness is an integral part of our overall well-being. It's about so much more than just reproduction. It's about pleasure, connection, feeling good in your own skin.
I love that. It's about embracing your sexuality and feeling empowered to make choices that support your health and your happiness. And we can't forget those practical tips we learned. Managing stress, exploring what brings you pleasure, and seeking out resources when you need them.
Exactly. Now, before we move on, I wanted to circle back to something Dr. Gottfried talked about in the Huberman Lab podcast. It was this thing called the estrobolome. It kind of sounds like something out of a sci-fi movie, doesn't it?
Estrobolome. I've never even heard that term before. What is it?
So it's actually a fascinating area of research that's shedding light on the connection between our gut health and our hormones. The estrobolome refers to the collection of microbes in your gut that can actually influence your estrogen levels.
Wait, so the bacteria in our gut can affect our hormones?
Yeah, it's wild, isn't it? And this is where things get really interesting. Some women have an estrobolome that makes them more susceptible to certain estrogen-mediated conditions, like breast cancer.
Wow. I never would guess that our gut health could have such a big impact on our hormonal balance and our overall health.
It really speaks to the interconnectedness of our bodies. Everything is linked.
So what can we do to support a healthy estrobolome?
Well, Dr. Gottfried talks about the importance of nourishing our gut microbiome with things like prebiotics and probiotics. They're basically food for the good bacteria in our gut.
So it's not just about what we eat for our own bodies, but also what we feed our gut bacteria.
Exactly. And Dr. Gottfried also mentions specific nutrients that can modulate estrogen levels, essentially helping to fine-tune that hormonal dance.
This is all so fascinating. It really makes you realize how much we're still learning about the complex interplay of factors that influence our health.
Absolutely. And this leads us to another important point that Dr. Gottfried raised in the podcast, the idea that being female is a health hazard. I know that sounds a bit alarming, but hear me out.
Okay, I'm listening. What does she mean by that?
Well, she's highlighting the fact that women are statistically more likely to experience certain health challenges than men are. For example, we have twice the rate of depression and insomnia.
Wow, I had no idea the difference was that significant.
And it doesn't stop there. Women also have a 3 to 4 times greater risk of multiple sclerosis and a 5 to 8 times greater risk of thyroid dysfunction.
Those are some pretty staggering statistics. It really makes you realize how important it is to be proactive about our health.
Exactly. We can't just wait for problems to arise. We need to be informed, advocate for ourselves, and get regular checkups.
So what are some of the factors that contribute to this disparity in health outcomes between men and women?
Dr. Gottfried points to a number of things, including hormonal fluctuations, differences in how our bodies respond to stress, and even just societal pressures and expectations that can take a toll on our well-being.
It sounds like it's a complex interplay of biology, psychology, and social factors.
Precisely. And it highlights why we need to take a holistic approach to our health, considering all of these aspects.
Now, I want to loop back to the topic of constipation that we touched on earlier. I'm still kind of intrigued by Dr. Gottfried's suggestion that it could be a sign of something more than just, digestive troubles.
Right. She believes that chronic constipation, especially in women, can be like a red flag for broader imbalances in the body. It could be related to stress, hormonal issues, even past trauma.
It's amazing how something we often dismiss as just a minor annoyance could actually be a clue to something deeper going on.
Exactly. It's our body's way of trying to communicate with us. So if you're struggling with constipation, it's really worth exploring what might be at the root of the issue.
So it's not just about reaching for a laxative, it's about figuring out what's causing the constipation in the first place.
Exactly. And that's where a personalized approach comes in. Dr. Gottfried emphasizes the importance of working with a healthcare provider who can help you uncover those underlying causes and develop a tailored plan to address them.
It sounds like we need to be detectives, unraveling the clues our bodies are giving us.
I love that analogy. And remember, you don't have to do this alone. Healthcare providers who specialize in functional medicine can be amazing partners in this process. They really take a whole person approach, looking at the interconnectedness of all your body systems.
That's so reassuring to know. Okay, let's shift gears again and talk about PCOS, or polycystic ovary syndrome. It's a condition that affects a lot of women. Dr. Gottfried sees PCOS as more than just a reproductive health issue.
Right. She emphasizes that PCOS is a significant risk factor for cardiometabolic disease later in life, meaning it increases the risk of heart disease, stroke, and type 2 diabetes. So it's not just about fertility, it's about your long-term health.
That's a really important point. It shifts the whole conversation about PCOS and really highlights the need for early intervention and ongoing management.
Exactly. And Dr. Gottfried is actually quite critical of the conventional medical approach to PCOS, which often focuses on just managing symptoms with birth control pills without addressing the underlying hormonal imbalances.
So she's advocating for a more holistic approach that gets to the root of the problem.
Precisely. She wants us to understand the complex interplay of hormones, insulin, and glucose in PCOS. It's about looking at the bigger picture, not just masking the symptoms.
That makes a lot of sense. So for someone who's been diagnosed with PCOS, What are some of the things they should consider?
Well, Dr. Gottfried encourages this multi-pronged approach that might involve dietary changes, stress management techniques, and even exploring therapies that address insulin sensitivity, since insulin resistance is often a key factor in PCOS.
It sounds like it's about empowering women to take control of their PCOS journey and work with healthcare providers who are knowledgeable about the complexities of this condition.
Exactly. Now let's touch on a topic that's often surrounded by misinformation: menopause. Dr. Gottfried really challenges the fear-mongering that emerged from that Women's Health Initiative study, which led many women to believe that hormone replacement therapy, or HRT, was inherently dangerous.
Yeah. I remember that study caused a lot of anxiety and confusion about HRT.
For sure. Well, Dr. Gottfried emphasizes that HRT, when prescribed and monitored appropriately, can be a safe and effective option for managing menopausal symptoms. It's about finding the right type of therapy, the right dosage, and the right timing.
So again, it's about personalized medicine, tailoring the treatment to the individual woman's needs.
Exactly. And it's important to remember that menopause is a natural transition, not a disease. Dr. Gottfried encourages women to embrace this stage of life, focusing on strategies that support their overall well-being.
So what are some of those strategies?
She highlights things like nutrition, exercise, stress management, and even exploring the potential benefits of certain supplements. It's about creating a vibrant and fulfilling life, regardless of your age.
I love that. It's about shifting our perspective on menopause and seeing it as an opportunity for growth and transformation.
Now, I want to bring up something we talked about earlier. It was the importance of young women understanding their hormone levels as early as their teens and 20s. Dr. Gottfried goes even further, suggesting that getting a coronary artery calcium score by age 45 or even sooner is crucial for women.
That's the test we talked about earlier that gives you insights into your heart health, right?
Exactly. It's a simple CT scan of the chest that can reveal a lot about your cardiometabolic health and help you identify potential risks before they become major problems.
So it's like a proactive step to protect your heart health.
Precisely. And this is particularly important for women because, heart disease is a leading cause of death.
So this test isn't just for men?
Absolutely not. It's relevant for everyone, especially as we age. It's about being proactive and taking steps to protect our heart health.
Okay, one more topic before we wrap up this part of our deep dive. Gut health. We've already touched on its importance, but Dr. Gottfried really emphasizes the role of the microbiome, the trillions of bacteria that live in our gut, and how they influence everything from our immune system to our hormone balance.
It's incredible to think that these tiny organisms are having such a big impact on our overall health. And Dr. Gottfried isn't alone in this belief. The field of research exploring that gut-brain connection is just exploding, and we're learning more and more about how our gut health impacts everything from our mood to our cognitive function.
Wow, that's amazing. So if someone wants to assess their gut health, what are some options?
Well, Dr. Gottfried mentions a few different tests, including stool analysis and breath tests. These tests can provide insights into the diversity and balance of your microbiome.
And based on the results, what kind of interventions might be recommended?
It really depends on the individual, but it might involve dietary changes, probiotic supplements, or even fecal microbiota transplantation in more extreme cases.
Fecal what?
Don't worry, it's not as scary as it sounds. It's essentially a way to repopulate the gut with healthy bacteria from a donor.
I'll have to do a deep dive into that another time.
It's definitely worth exploring. Now, before we move on to the final part of our deep dive, I want to emphasize something that resonated really deeply with me from all of our sources today.
Yeah.
It's the importance of personalized medicine.
Yes. It's about moving away from that one-size-fits-all approach to healthcare.
Exactly. It's about recognizing that each woman is unique. She has her own hormonal blueprint, her own health history, her own goals. It's about finding what works for you.
I think that's such a powerful message. It's about taking ownership of our well-being and seeking out those resources that support us.
And it's about embracing the complexity of our bodies, recognizing that there's no quick fix, but rather an ongoing journey of discovery.
That's a perfect note to end this part on. So take a moment to reflect on what's resonated with you so far. What insights have you gained? How can you apply them to your own life?
Hold on to those thoughts, and we'll be right back for the final part of our deep dive into hormones, health, and you.
Welcome back, everyone, for the final part of our deep dive.
I know, right? It's crazy how fast the time flies when you're having these fascinating conversations.
Seriously. Okay, so we've covered so much ground already, from understanding those hormonal cycles to navigating the challenges of PCOS, menopause. We even explored how our gut health, it's so wild, can impact our well-being in all these different ways.
Yeah, so many surprising connections, right?
Right. And I mean, who could forget that regular intimacy might just be the secret to a stronger immune system?
Definitely a perk.
I know. I'm going to add that to my to-do list today. But before we wrap things up, there's one more piece of the puzzle that I really want to dig into. It's something Dr. Gottfried touched on in that Huberman Lab interview that I think deserves a little more attention.
You're talking about the role of trauma in women's health, right?
Yes, exactly. You mentioned it a little bit earlier, and I'm really curious to hear more about how trauma can actually impact our hormones.
Yeah, well, research shows that experiencing trauma, especially during childhood, can really have a lasting effect on our stress response system. It's like our bodies get stuck in that fight or flight mode, even when there's no real danger present.
Right. Trauma can leave you feeling like constantly on edge, always bracing for something bad to happen.
Exactly. And when our bodies are in that state of chronic stress, it can totally disrupt our hormonal balance.
Yeah.
Cortisol, our main stress hormone, it can go haywire, and then that throws other hormones out of whack too.
So it's not just an emotional wound. Trauma really has this physiological impact on our bodies.
Precisely. And Dr. Gottfried really believes that we need to acknowledge this mind-body connection and start addressing trauma as a fundamental part of women's healthcare. It's not just about treating the symptoms, it's about understanding those root causes and really supporting women in their healing journey.
And this really ties back to what we were talking about earlier, taking that holistic approach to health. It's not just about those individual symptoms. It's about seeing that bigger picture, understanding how our experiences, our environment, our biology, they're all woven together.
Yeah, I love that analogy. It's like a tapestry, as you said before, each thread woven into this larger, more complex picture. And trauma is often a really significant thread in that tapestry for many women.
So what are some practical things that women can do to address trauma and support their healing? It can feel kind of overwhelming to know where to even begin.
I know, you're right. It can be daunting. Dr. Gottfried emphasizes self-care practices, things that can help regulate your nervous system and promote a sense of safety and calm.
Okay, so like what kinds of things?
Well, she talks about getting enough sleep, eating nourishing foods, moving your body in ways that feel good, and spending time in nature. It's really about tuning into your body's needs and creating that sense of inner peace.
Those are great suggestions. It sounds like it's about finding those practices that help you feel grounded and connected to yourself.
Exactly. And finding healthy ways to manage stress, too. Because stress can be a huge trigger for those trauma responses. So things like meditation, yoga, breath work, or even just spending time with loved ones can be really helpful.
And of course, seeking professional support from a therapist or counselor who specializes in trauma can make a world of difference.
Oh, for sure. There's no shame in reaching out for help. In fact, it's often the bravest and most empowering thing you can do. And I want to emphasize something Dr. Bond talked about in the PanHABA webinar. It was the importance of finding healthcare providers who are trauma-informed.
What does it mean for a healthcare provider to be trauma-informed?
So it means they understand the profound impact that trauma can have on both our physical and our mental health, and they approach their patients with sensitivity. They create that safe, non-judgmental space where you feel heard, respected, and understood.
That sounds so important. Just feeling safe and validated by your healthcare provider can make such a huge difference in that healing process.
Absolutely, and it's something we should all be advocating for in our healthcare system.
Okay, so as we wrap up this incredible deep dive into female hormones and health, what's the one key takeaway that you want our listeners to walk away with today?
If I had to choose just one, I'd say this. Listen to your body. Your body is incredibly wise, and it's constantly sending you messages.
We've talked about so many different messages our bodies might be sending us, right? From digestive issues to mood swings to changes in our cycles.
Exactly. And it's not about overanalyzing every little thing. It's about cultivating a sense of awareness. Becoming attuned to what your body's telling you. Pay attention to those subtle cues, and don't be afraid to ask questions.
And remember, you're not alone. There are so many incredible resources available to support you on your journey. The sources we discussed today, they're a great starting point, but it's just the beginning. Keep learning, keep exploring, and keep advocating for your health and well-being. You deserve to feel vibrant and empowered and in control of your own body.
I love that. It's so true.
Well, thank you so much for joining us today. It's been an incredible journey of discovery.
It really has. It's been my pleasure. I always love diving deep into these topics.
And to our listener, thank you for being here with us. We hope you gained some valuable insights that you can apply to your own life. Remember, knowledge is power, and when we empower ourselves with knowledge, we can really transform our health and create lives that are truly fulfilling. So until next time, keep diving deep, everyone.